All right. So if you have to cover COPD under 3 minutes, how I would cover it? I'm a board certified pharmacist, and let's get to this. So COPD is actually a chronic obstructive diseases, and it's a lung inflammation, progressive. We have to manage the symptoms. How would we cover it? So for that one, so initial assessments and treatment, right? So this is assessments and treatment. So for that one, we have groups. This is the one diagram, okay? And we have group 1, B, and E. And this is based on the GOLD guidelines, okay? GOLD guidelines is the Global Initiative of Chronic Obstructive Diseases. And this is what is the criteria, and then we get um, how we manage it, right? So patient falls under group A, B, and E based on some symptoms and based on some uh, exhibition. So symptoms, as we know, is breathlessness. We know that is dyspnea. There is sputum productions. Okay, and then there is exhibitions. So what are exhibitions? So exhibitions are actually worsening of the symptoms in less than 14 days. Okay, that is called exhibition. So patient in group A are those patients who has um, these symptoms. Okay, for these symptoms there is a certain test which is called MAT, which is a medical assessment test, which tests actually the breathlessness. Okay, and they have a scores of 0 to 4, and higher scores actually is the worst score. And there's another test which is called CAS score, and CAS score is actually COPD assessment score, which assess these four symptoms, like dyspnea, sputum production, and all these. And this is up to 10 and to 30 something. But if the CAS score is greater than 10, then that will fall under group B, and the or M score is 1 or 2, or the CAS score is less than 10, or exhibitions um, 0 1, that is called as this. But in these two criteria, there should be no exhibition. But if there is exhibition in any of these scores, that falls under group E. Okay, so for group E, we use uh, these are the exhibitions, right? 1 or 2 per air, okay, per air. So for the first two groups, we actually initiate LAMA or LABA, okay? So remember that in asthma, we do not initiate LAMA or LABA as a monotherapy, because it has been reported that there is more mortality rates with monotherapy of these agents. Instead, we have to use ICS as the initial therapy. But in COPD, we use LAMA or LABA, which is LAMA is actually long-acting muscarinic antagonist, which acts on the AMP receptor in the lungs and cause bronchodilatations, right? Or LABA, which is long-acting beta-2 agonist, and bronchodilation in the lungs. So LAMA or LABA are the combination of these two, okay? But in the group E, we have to add LAMA, LABA plus ACS, okay? Plus ACS, which is inhaled corticosteroid. But there is criteria for inhaled corticosteroids, because patient who has used inhaled corticosteroid in COPD patients, there have been increased chances of death or exacerbations. So there is some criteria. For that one, we have to assess eosinophil count, because eosinophil is one of the WBCs, right, which is higher in inflammation. So for that patient, if the eosinophil is greater than 300,
We can use ICS, otherwise we have to use Romiflast, a FIDA4 inhibitor.